Thanks very much. Thanks, Claire. Welcome, everybody, to our webinar, Cancer Care on a Changing Planet, as part of London Global Cancer Week. This is the second collaboration between Oncologists United in Climate and Health and Cancer Trials Ireland. So we're very privileged to host this. We've an excellent lineup of speakers this afternoon, focusing on the impacts of climate change on how we work, and then in the first part, and then solutions to making how we work more climate friendly. So I'm going to hand you over now to my co-host, Joan Schiller, who's a founder of Oncologists United for Climate and Health, and we're delighted that you can be part of this and to continue our collaboration with Ouch.
Right. I'd like to thank everybody for attending, and I'd like to thank in advance the speakers for speaking. But I am going to be introducing Dr. Khurram Tariq. Dr. Tariq recorded his talk earlier, so we'll be watching his recording. He is a medical oncologist who practices in the southeast part of the United States, and which was hit by a major tornado with lots and lots of flooding last year. And he was right in the middle of it, and I think he's going to tell us about it. So thank you.
Good afternoon, everyone. My name is Khurram Bilal Tariq, and it's such a pleasure to connect with you through this Global Cancer Week webinar event. I'm sorry I could not connect live. I'm actually traveling for a hematology conference in South Asia. But these are my credentials. I am a hematologist and medical oncologist for Intermountain Healthcare. Intermountain Healthcare is a healthcare entity within the western part of United States that also specializes as being the pioneers of tele-oncology. So we'll tie all of that together as we go through this presentation. I did my residency training at University of Florida in Florida, and many years later, I was invited back to be awarded the Distinguished Alumni Award 2025 for my work in rural communities in different parts of North Carolina. So after completing my fellowship in Augusta, Georgia, in the state of Georgia, I moved back to North Carolina, which is where I grew up. And I was the program chair for a rural healthcare system in Boone, North Carolina, when we were struck by Hurricane Helene in September of 2024. So this is a glimpse of how it looked like when I woke up one morning and could not leave my neighborhood. This is a panoramic view, so the dimensions are a little skewed, but please realize that this red dot that you can barely see is the top portion of the traffic stop sign that you see on street corners all over, and it's probably 8 to 9 feet tall. I don't know how tall it is, but it's probably that tall. But this is all you can see. So we were in the neighborhood, facing this flood area, and we were on a hill, but completely stranded. We were without water, electricity, or internet for about 6 days. And early on, because the power lines were down, we could not even leave the house. But then later, I have two little kids. I had two little kids at the time, and we decided to take them to my sister's place, which is about 3 hours away. So if you know anything about Boone, it is that it's a beautiful place. People come there for vacationing. It's also where a lot of people spend their summers, because it's at an elevation of about, generally speaking, 3,000 feet to 4,500 feet, depending on where you are. So it stays cool during summertime. And so this is what it looked like. This is the university campus of Appalachian State University. And as you can see, just water everywhere. And I'm sure it made some students happy that they did not have to go to school, but realistically, it was a very sad situation for pretty much everyone in the area. So on the left, you see a picture of a road that has been washed away by just water gushing through everywhere. Um, and water may seem very benign and docile at times, but it's a force of nature that um, it's very difficult to deal with, especially when it's coming at you with a vengeance. So this is to give you a sense of how entire communities were cut off when the limited infrastructure in this rural part of Western North Carolina was hammered heavily by the hurricane. The hurricane also resulted with the pictures that you see in the middle and on the side. As you drove through town, you saw all kinds of belongings out on the street. They were just completely flooded. And while they were reduced to trash, for the lack of a better word, these are memories. These are people's subsistence. And so many individuals were left without home. This is a picture from the downtown of Boone. And as you can see, just inundated with water and a very difficult situation to really handle. So then the community came together along with the help that they had received from the local and national government. This chopper that you see on the left is to say that, supplies were brought in. A lot of times they had to be flown in. And what you see on the right is a parking lot of a local Walmart. The Walmart itself was also flooded and had to be shut down for probably 6 months before it was opened again. However, in its parking lot, it was the lot itself was changed to community showers and laundry for a number of months. So it was a very, very difficult situation for pretty much everyone. This picture is to emphasize that what happened was not just acute and grave in nature. As you can see in that first road closure, that while the hurricane took place in September of 2024, this road was expected to stay closed until September of 2025. And this is a major highway that connects different parts of that area. So families were cut off. I know one family, this elderly couple, whose house was cut off for them from the rest of the community, and were only discovered afterwards. When they were discovered, their house had completely been destroyed. It's a miracle that they survived. But then the community came together to help them build a house that they could then live in. So what are the implications of a natural calamity like the Hurricane Helene on our rural communities? And there are different aspects to that. One of them is, of course, the fragility and isolation of the infrastructure to begin with. And when roads and bridges are damaged, it's very difficult to reach different communities that often become inaccessible, like what happened in Boone, North Carolina, due to washed out roads and bridges. And this makes patient transport and supply delivery nearly impossible. Therefore, rural areas need redundant transportation plans, including air evacuation and mobile clinics. Also, because of the failure of utilities, I know at one point there was a leakage in the basements of one of the cancer centers, due to which the basement was flooded and the entire cancer center was shut down. Now, as we know, some of the medications have to be maintained within a certain temperature range. So how do you manage a situation like that? Extended outages of electricity, water, and cellular networks basically cripple these communities and care coordination. So therefore, it's important that thought is given in investing in backup power systems, satellite communication. You may have heard of Starlink, for example, and just water purification units, which is all very critical. So next on the list is continuity of care for chronic conditions. And for example, patients who are on opioid use, diabetes, and cancer, they often face interruptions when rural communities are hit by um, nature-related calamities. Therefore, we need to have flexible policies, emergency prescription refills, telehealth waivers, and pre-disaster medication stockpiling to just help these patients through this very difficult time. Then there is the issue of supply chain resilience. And the one example that comes to mind is the flooding of Baxter's IV fluid plant in North Carolina, which caused a national shortage, showing how a single point of failure within the supply cascade can bring everything to a halt. So rural hospitals should maintain regional stockpiles and mutual aid agreements for critical supplies. Then there is the role of larger health systems and coalitions to help, especially the cancer centers that are a little isolated. One example that comes to mind is, how Advocate Health and HCA leveraged mobile care units and air transport and centralized emergency operations centers to support rural facilities. Partnerships between smaller clinics and similar larger systems can dramatically improve disaster response at a time when it's needed the most. Then there is the data-driven emergency response, in an age of rapid geospatial analysis, collecting useful data can be very helpful in identifying prone areas that are prone to not just hurricanes, but droughts and other infrastructure related issues. So rural health systems should integrate decision support systems, DSS, for real-time situational awareness, which can then help with diverting resources and also make the community in these areas aware of what to expect next. So then there is the issue of community engagement and local leadership, and emergency shelters like the one I showed, making the parking lot of the Walmart into a laundry facility and shower area, and then there were other areas that were also converted within the town of Boone to temporary shelter. So these resources, impromptu resources, and local volunteers are really vital when formal systems have failed. And building community-based disaster coalition and training local leaders in emergency health protocols can really strengthen resilience. Last but not least is mental health and workplace support. So when any community is hit with a calamity of any sort, it's not just the patient, but their entire families who suffer. It's also the providers, whether it's the doctors, the nurses, the PAs, or the nurse practitioners who face extreme stress and isolation. I was not able to reach work, but the stress of not being able to provide care for my patients really weighed heavily on me during that time. So peer networks like the Chief Quality Officer Network facilitate real-time sharing of strategies and emotional support, which is very important. And then rural systems should prioritize staff well-being and cross-system collaboration. And additional resources can also be placed in making sure that the mental health of individuals, not only those that are suffering, but also those who are providing care, is catered to. So this is all from me, and thank you so much for giving me the opportunity to connect with you. Please reach out to me if there is anything that I can assist with. Thank you, and have a wonderful rest of the conference. Bye-bye.
Thank you very much. That was very insightful and sobering. The impacts for months after the event were similar to what we've seen with in Brazil, where it took 6 months to recover from flooding in the Porto Alegre area. Our next speaker is Sara, Lightowlers, who's joining us from the United Kingdom, who have really been at the vanguard of sustainability in healthcare. They have pioneered an NHS Zero, and were one of the first healthcare systems to sign into law. I think probably the first system to sign into law the move to net zero in healthcare as part of a recognition of our climate crisis. So we're very grateful to you joining us today, Sara, to hear all of the great work that's being done in your units in the United Kingdom.
Thanks very much, Seamus. I was just trying to come off mute. Can you hear me?
Yes, you can. Thank you.
Brilliant. Okay, and can you see my slides?
Yes.
Okay, brilliant. So yeah, thank you very much for having me here to speak to you today. So my name's Sara Lightowlers. I'm a clinical oncology registrar in the east of England, so Cambridge, UK. And I'm a member of the UK Radiotherapy Board's Environmental Sustainability Working Group, and also a recent alumna of the NHS Chief Sustainability Officer's Clinical Fellowship. So I'm going to talk a bit about sustainability in the NHS in radiotherapy, and about the recently launched UK Green Radiotherapy Framework. I've got no conflicts of interest to disclose. So this is my sort of standard introductory slide. But
Sarah, I'm sorry to interrupt you. We're just not seeing the slides progress. I think we're not seeing your presenter mode. We're seeing kind of the other screen.
Oh, right.
We can see that one now.
Okay. And how about now? Are you seeing the slide with the climate impacts on cancer patients up on the screen?
And we can just see slide 3. We're sort of seeing the view where there's the slides on the left,
Okay,
rather than the full screen.
Oh, I'm so sorry about
Sarah,
that.
it's like you haven't maybe started the slideshow part yet. You're just seeing the working document.
No, I mean, I am starting the slideshow on my computer, so I don't know why it's not coming up like that when I present. But shall I just go through and click from slide to slide, and then you'll be able to see?
Yeah, that's fine, as long as you keep us up with what you're saying.
Yeah, of course. I'm so sorry about that. So as I was saying, this is my sort of standard introductory slide, but I think Khurram's presentation has just really illustrated everything I wanted to say about how relevant climate change is to us as healthcare professionals, because of the many risks to our patients. You know, and of course, my view is that we have a duty to first do no harm and minimise the contribution of our professional activities to climate change. So we can all see that healthcare is really resource intensive, and that does add up to a large carbon footprint. And in England, the NHS has a legal duty to address this by getting to net zero greenhouse gas emissions, including those from its supply chain, by 2045. And as you can see from this chart up here, we are making good progress on addressing the direct emissions, which are down here in the red colours. And this chart only goes up to 2019, so more progress has been made since then. So estates and sustainability teams at NHS trusts around the country have been very hard at work on everything from installing solar panels onto hospital roofs to changing leaky nitrous oxide pipes to cylinders. But the NHS carbon footprint is clinically driven. And you can see from this pie chart figure down here that most of the big contributors to this are clinically relevant. And that means that clinicians can make a big difference as well, particularly on supply chain emissions, which we're making much more complicated to make progress on. So how much of this healthcare carbon footprint results from radiotherapy, and where in the process does it come from? If we know what the big contributors are to this, then we can try to target these hotspots to have the most impact. And there have been an increasing number of publications aimed at answering these questions over the last few years, with a very wide range of answers on the total carbon footprint of a radical or adjuvant radiotherapy course, from around 100 kilograms of carbon dioxide equivalents to over 5,000. And some of this difference probably reflects that the researchers were all different in which sources of emissions they included in their analysis. So, for example, this figure down here comes from a paper by Lightowlers et al. In the US, which included the heating, ventilation, air conditioning used in the radiotherapy department, and found it contributed substantially to the overall footprint. While this paper up here by Schutter et al. In the UK didn't look at this. And not all of the analyses included the construction and maintenance of the linear accelerators, but those which did also found that gave rise to a lot of greenhouse gas emissions. In the majority of the analyses, patient travel made up a large proportion of the overall carbon footprint. And you can see in this figure up here from Schutter et al. That the total carbon footprint is much lower in this central bar from the analysis, which was from a central London hospital where travel was much more likely to be by public transport. And then this figure down here on the bottom right is from analysis from Duprat et al. In France, which split the total carbon footprint into a fixed part and a per fraction part. Which really illustrates that one of the most powerful things we can do to reduce the climate impact of radiotherapy is to hypofractionate wherever it's appropriate. And some of these papers and others have also modelled or suggested other strategies that could be used by radiotherapy departments to reduce their overall carbon footprint. And I'll go through some of these in a minute. So when the Radiotherapy Board's Sustainability Working Group formed 2 years ago, I was feeling quite a big dose of imposter syndrome at the time. I didn't see myself as the sort of person who was part of a national working group, but I knew that given the scale of the problem, we should try and do something ambitious, aiming for a big impact. And that meant thinking about how to get departments around the country engaged in this work and pulling in the same direction. So I reached out to other professional bodies, and this was a really encouraging process. Everyone who spoke to us was very open and helpful and very happy to share their experience. And we spoke to a few different specialties in which the professional bodies had produced tools of various types to guide sustainable practice. So the Royal College of Emergency Medicine in the UK have produced a tool called the Green ED Framework, which is a collection of different actions and changes that emergency departments can implement to be more sustainable, organised into bronze, silver and gold award levels for which departments can apply. Then in the middle, this is a tool produced by the 4 Royal Colleges of Surgery in the UK and the Royal College of Anaesthetists. So they collaborated to produce a set of actions called the Green Theatre Checklist. And then the Royal College of Physicians had produced the Green Physician Toolkit, which was a long form guidance document with some case studies on lower carbon medical care. And there's no evidence around what format or approach is most effective in encouraging low carbon care within specialties. But having reflected on the various models already in practice, we felt that the gamified aspect of the bronze, silver and gold levels in Green ED might be a helpful motivator. And so the idea of the Green Radiotherapy Framework was born. And we've also organised this into 3 levels, bronze, silver and gold, each with 5 domains. Actions within the bronze domains are those judged to be least challenging to implement, while those at gold level are judged to be more challenging, but perhaps with more impact. So This is the problem with not being in slideshow mode, that you can't see the domains behind the sort of example, but I'll go through them now. So this is the bronze level. The domains are medical waste and circularity, concomitant chemotherapy, linear accelerator idle time, non-linear accelerator electricity usage, and non-medical waste. And what you can see up on the screen is just an example of something a department could implement to tick off one of these domains, in this case medical waste. So this is from a survey of UK radiotherapy departments we undertook to see what sustainability work was already being done around the country. So the radiotherapy department at the Royal Marsden switched from single-use cups for bladder filling to reusable drinking bottles, and they found an added benefit of better patient compliance. And then behind the box on the screen there are the silver domains. I'll just go through those. So there's a staff travel, review of patient travel, linear accelerator active energy usage, and SF6 gas leakage, integration of sustainability into departmental audits or quality improvement projects, and communication with staff. And what you can see in the box is an example of an action a department could take for one of the silver domains. This was submitted from Mount Vernon Hospital, where there was a multi-pronged approach to staff communications around sustainability, including a talk during new staff inductions, posters, inclusion in mandatory training, and talks at all staff meetings. And at the time of submitting this to us, they were planning on surveying the impact of all of this on staff awareness and engagement with sustainability initiatives. So we really need to follow up with them and find out what the result of all that is. And then the gold domains of the framework are hypofractionation. So as I said, this is one of the most impactful things we can do in radiotherapy. And what we'd really want to see to get the marks in this domain is, you know, departments not just showing us evidence that they use one hypofractionated schedule, but having a mechanism in place to make sure that these regimes are reviewed and implemented promptly as soon as that's clinically appropriate. And then the other domains are patient travel, building design and infrastructure, protected clinician time for sustainability, and integration of sustainable procurement models. And the example I've included here is again from our survey for a domain at this level. And it's an initiative from Sheffield, who have charitable funding to provide minibuses from 3 locations around their catchment area. And are looking at the moment at how to quantify the avoided greenhouse gas emissions from this service. And then alongside the actions at each level in the framework, we provided some resource links, a very rough estimate for avoided carbon emissions, and for future versions we hope to refine this as more evidence becomes available. So the framework was launched a few months ago in July of this year. And the full details of it are available on the Radiotherapy Board website for anyone who would like to take a look. And we're very keen to hear any feedback on the framework, and particularly any suggestions or examples of actions that aren't already included. And the plan is very much that the framework will evolve over time, incorporating new ideas from the UK and around the world. So please do get in touch on either of the email addresses on the screen if you have anything you'd like to share with us that you think we should consider for a future iteration. That's everything I had to say about that for now, but happy to take questions at the end of the webinar. Thanks very much for listening. I'm trying to stop sharing, but it's very slow.
I was going to say, thank you very much, Sarah. That was an excellent and insightful talk, and I'm just sorry you had technical problems there, because I would have liked to have seen what was behind the boxes, but
oh, do have a look on the website.
Sorry?
Do you have a look on the UK Radiotherapy Board website? It should all be up there.
Oh, maybe you could put that in the chat?
Oh yes, I will do.
That would be great, thank you. I have the pleasure now of introducing Dr. Una Fitzgerald, who is an associate professor of biomedical engineering at the University of Galloway. She is an advocate for lab greening in Ireland, and the lab where she is based, Khurram, was the first in Europe to gain My Green Lab certification. She will present green lessons from the lab and will be talking to us about sustainability initiatives within the scientific research community. Una?
Thank you very much, Joan. I appreciate it, and apologies for being unable to sort out the access there. So I'll next slide, please. Am I able to move them on? If I had host status, maybe. You can't change my.
I think not. I think I just need to do the next slide, I'm afraid.
Sorry about that. Yeah, just can quickly move on. Thank you very much, Seamus, for the invitation to speak here today. I appreciate it. And just to explain very briefly, next slide, that this kind of kicked off. I mean, my background wasn't in this, but 6 years ago, I read this book called No More Plastic. And of course, next you'll see on the next slide that after reading this book, next slide, please, I bought my bamboo straws and my keep cups and my reusable water bottle and bags and all that. We did have an electric car already, but that was all very well for what was happening at home. But then I was walking into work and noticing, which I should have been doing decades ago, noticing the mountains of plastic that were mounting up in the labs. And my first postdoc, by the way, was in the Beatson Institute in Glasgow. So I was doing cancer research at that time, but then I've switched into neuroscience. This far outweighed what I was doing at home. Next slide, please. So when I started thinking about that, I realized that we have a massive plastic problem within life sciences in particular, and certainly in cancer research as well. This is a typical image of a biosafety cabinet that's full of different kinds of plastic. And next, please. But then, of course, if you start paying attention to the environmental impact of what you're doing within labs, then you notice, well, okay, yes, I've noticed that plastics are a problem, but this isn't the only impact that laboratory work is having on the environment. And that led me to do some more digging. But for instance, it's well accepted now that labs can use up to 10 times more energy than office space, let's say on a university campus, for instance, or in an institute, or maybe 4 times more water than elsewhere in non-lab spaces. So, and if you get into this space, what you learn is, next slide, please, that the concept of lab greening or sustainable lab practices in general is accepted to have kicked off really in the US when the International Institute of Sustainable Laboratories was set up. And this was because the facilities managers noticed this disproportionate amount of energy that was being used in campuses in the US. And then the Ivy League universities, the huge ones, Harvard, CU Boulder, etc., set up their own Green Lab programs. And then after that, I'm not sure exactly of the year, I haven't been able to find out, but S Labs was set up in the UK, kind of a mimic of I2SL, and Green Lab Impacts then was set up by these students, also headquartered in the UA, but it's international now. And then in 2013, Alison Paradise set up My Green Lab. I'll come back to that. 2015, Lean Network in the UK, followed by the second certification worldwide, which is LEAF, which is run from UCL in the UK. Max Planck Institute in 2019, and then in 2022 we had the European Labs Network, Irish Green Labs, and the European Federation of Clinical and Laboratory Medicine were set up. And so, next slide. Getting back to Alison, I mean, she was working as a neuroscientist. She was doing her master's in Harvard, and she did not like the way things were being done. So she left the lab to set up this non-profit organization called My Green Lab. And next, please. Thank you. But what I want to emphasize here is My Green Lab is kind of the gold standard at the moment. There are other certifications, as I said, not many though, and this was the first one. And what happened in 2021 was that these two individuals, the high-level UNFCCC champions, so this is kind of rotating role, but in 2021, these two individuals, next slide, please, what they did was they published this report called Upgrading Our Systems Together, and this was in their campaign for the race to zero emissions worldwide. And so what they did next is that they defined breakthrough outcomes for 30 societal sectors within the global economy. So they were identifying really the first thing that should be done in these different sectors globally. So for the medtech and pharma sector, the one thing that they said should be done, so next slide, is that by 2030, 95% of pharma and medtech companies should have their lab certified by My Green Lab. So even though this was focusing on emissions, and you would think primarily energy, they recognized that that program in general was going to help reduce emissions and help globally in the race to zero emissions. So that was highly impactful, and I think it demonstrated how impactful the My Green Lab certification is. So next slide, please. And just to let you know that My Green Lab runs a number of programs. We're focusing on certification here today, but I want to draw your attention to the Freezer Challenge, which is kind of a good entry-level sort of activity to get into if you want to try it out, the certification. There are My Green Lab Ambassador Training, which is free, and then another not very expensive My Green Lab accredited professional program, which I think all technical staff should take. Postdocs and research labs should also take that. And then an ACT label, which would help you to pick more sustainable lab products when you're ordering things, okay? So we don't have time to go into all of those, but next slide, please. If you are, it's not surprising that there's a real uptick in the number of labs globally that are pursuing Green Lab certification by My Green Lab since that UN backing in 2021. As of May this year, there were 4,500 labs worldwide that are certified in, I think it's something like 50 countries, but this is actually only 1% of the estimated 500,000 labs that are actually out there around the world. So next slide, please. Just to make you aware that in 2013, Alison set up like assessment 1.0, and to let you know that as of January this year, there is an improved version of it, if you like, which is run by a subsidiary of My Green Lab called Impact Laboratories. The advantages here are that there are fewer questions for the people within the labs themselves that are to be answered. There are gatekeeper-style questions for the facilities managers to answer. And then there are different weightings within the categories, like energy having more weighting than, let's say, engagement, or green chemistry and energy would have big weightings, and large equipment use and things like that. So that's the new system, and it's excellent because there are tools within the platform for estimating the impact of what you're doing. Next slide. And funders are also taking an interest, and this is actually very helpful. To give you an example, when Science Foundation Ireland, now called Research Ireland, published its climate action strategy, it had 3 pillars, and the third one was that the research that they fund should be conducted sustainably. And in the last couple of years, they actually paid for the certification by My Green Lab. So they had a tendering process, and My Green Lab won the tender. And they funded the certification of 100 labs in the last couple of years. And this is a great example. But if you go to the next slide, you'll see that Cancer Research UK is also mandating now from January next year that their research labs should have either LEAF or My Green Lab at the silver level. So what's nice about that is they're not requiring that you just get a pass mark, if you like. You have to show impact as well. So that's excellent. And then the Institute of Cancer Research, which has 3 different sites in the UK. I've highlighted that, and I've got the links to the policy and to this report. But the nice thing about the ICR is the case study that you won't be able to read at this magnification, but they make their own medium on site. So you're not having it shipped in bottles, in these volumes. So this is an excellent example of best practice, I think, in trying to reduce the footprint of cancer research in particular. So next slide, please. And here across in the US as well, the NIH Green Labs program is active since 2023. Then you have back in the UK, the Cancer Society, the Royal Cancer Society. Then you have at European level, the Marie Curie Green Charter for people who are doing research. And then a very important thing, which is this Concordat that was set up in the UK. It's hosted, there's a website, it's hosted by the Wellcome Trust, and there are 25 organizational signatories there, and Green Lab certification is mandated. So this is all incredibly helpful, but it also illustrates that people recognize that pursuing a Green Lab program is a good thing and it will have an impact. So that's really, really useful. And next slide, please. Thank you. And just, again, 6 papers here that you might find useful. So there's an uptick, if you like, in the number of labs that are being certified as green. And also it's reflected in the literature. There are more and more people getting involved in this. So, and publishing what they're doing. And this is what we actually need. So I put the links to each of these papers here. And the freeze one in particular, which was published this year, or just last year, is very, very comprehensive and detailed and contains a lot of very useful information here. I recommend that you go and take a look at them, and I'm going to mention one of these in particular in a couple of slides. So next slide, please. To give examples here, this is just an exercise that we went through in Khurram. These are images of some of our freezers in Khurram and Galway. And we went through a metering exercise. So up chilling, you know, where we warmed the freezers from minus 80 to minus 70. And you save a quarter of the energy when you do that. And I've got some figures in the next slide to show you that by warming these freezers by 10 degrees, we save 2.2 tons of CO2 per freezer, so 6.7 tons of CO2 avoided. So that's a typical example of what goes on. One freezer did the measurement. It's the same as an average Irish household at minus 70. But if you are using minus 80, it's 30% more energy is used. So it's one of the first things that labs can do, and it's pretty simple to do. So next slide, please. To give you a cancer example, in the University of Aberdeen in Prof. Valerie Spears' lab, that lab used the LEAF certification program. But what she showed here is that when her group cultured MCF7 cells on a Petri dish that was made from PLA, so it was a bioplastic and it's more easily degraded, that she couldn't tell the difference, at least by observing the cells, between that and growing them on the standard polystyrene Petri dishes. And she also showed that the PLA was breaking down more easily after autoclaving. So that's a good example from a cancer lab. And you can see that people are interested in doing this. And this was a very quick study, and it was published. You know, so there are opportunities for publishing if people keep track of the impact of what they're doing. So you can have kind of two streams of publications, if you like, if you start to get involved in this. And then next slide, I think we're getting towards the end here. Oh yeah, I just want to quickly draw your attention to these, especially if you are in units or, you know, even hospitals. Granova is a company that sells a tip washing machine. I think all hospitals should have this. I think all universities should have it. Well worth doing. And they also have a plate washing machine. Labcon is an American company, so if you're based there, I recommend you look to them. They've been working for decades on making their operations greener. They have a lot of green plastics that they sell into labs. Right Cycle is based in the UK. It was the first recycling program for gloves. Really, they've got loads of evidence of the reduction in emissions and the circularity of the gloves. So I think that's really worth doing. Envitech is a company that's based near Limerick in Ireland, and they are selling units to hospitals in New York that decontaminate biohazardous waste. A huge reduction in emissions as an alternative to autoclaving. And you can generate flock that can be then sold on to other entities. So again, I just recommend that you have a look at those. And next slide, please. Yeah, so this is the kind of lessons and recommendations. That number one, the global reach of labs is huge. So if people do start to get involved in green lab programs, you will reduce the environmental impact of those kind of activities. Pursuing the program will save you money and also be better for the environment. The pressure from cancer research funders is very, very welcome, and it should accelerate lab greening impacts. And the use of greener protocols, materials and equipment, it does need to be supported centrally. So there needs to be a pot of money around to support this sort of thing. But it's already documented by My Green Lab that the return on investment within the biotech sector is like fourfold. So once you start spending money on it, you will save money, and it will pay for itself ultimately. I do think that training in Green Lab principles and practice for lab associated staff should be mandated. For example, the free one, My Green Lab Ambassador, let's say, for all students, and the accredited professionals, as I said earlier, is well worth pursuing. There are 6 modules there, and you can look it up on the My Green Lab website. And I think senior buy-in is essential from the start. And it is a very active and motivated community if you want to get involved in it. And there are a lot of resources available, so I do recommend it. And then I think that's my final slide. So thank you very much for listening.
Thanks very much, Una. it's amazing that it's only 1%. It's for how many labs there are.
Yeah.
I thought that 1% figure was dramatic.
It is dramatic. I mean, I think that when you think of even the medtech sector or pharma, like how do they prove their things are sterile? They have labs. You know what I mean? Like if you start counting it that way, how do we have clean water? How is our food safe? Everything's tested. It's like all of this has been under the radar and hidden, and people aren't aware of the impact, you know. So if you start paying attention to it, I think the reach is pretty big. Yeah. Thank you, Seamus.
Thank you. And thank you for being here today. So our next speaker is Professor Maura Brown, who's joining us from the University of British Columbia. We see the snow. So thank you for joining us. So Maura is on the faculty of University of British Columbia and is a radiation radiologist, and she leads initiatives in planetary health in BC Cancer Centre, but she also has a national international role in advocating for sustainable radiology, and integrating planetary health education into radiology is her one of our most recent publications. So we're delighted you could join us today, Maura, and look forward to your talk.
Thank you so much. Now, just checking, can you see the slide okay?
Yeah, perfectly.
Yep.
Thank you.
And you can hear me?
Yes.
Yeah, okay. I am a long way away. Thank you very much for the kind introduction. So I'll just go back to my introductory slide again. I'm really grateful to be invited and part of the community tackling planetary health and healthcare, and all the amazing people, the amazing talks that we've heard so far today. And I hope that I'm able to contribute to inspiring people who are attending to doing some of this work in your own facility. So some disclosures, none of which are relevant to today's talk. I'm going to talk, typically I start a talk about climate and air pollution and biodiversity loss and how that impacts our health. However, I know others are doing that. So today I'm just going to focus on opportunities we have to contribute to low carbon, high quality, climate resilient healthcare, specifically with reference to radiology, because I am a radiologist. The warming stripes background to these slides, many of you will have seen. It's a visualization of our warming climate from 1850 to present, created by Ed Hawkins, who's a climate scientist and artist. Climate change will affect all of us and our communities. Many of you have probably heard about the wildfires in Canada, which are now happening every summer. I was first drawn into this work after one of our really bad wildfires in 2017. The photo on the bottom left is a normal summer morning at Christina Lake, which is a little family cabin we've gone to every year. The bottom right is a few days later, where smoke from a fire filled the valley, and it hung around for days. You could smell it, you could breathe it, people were coughing. I knew then that I had to jump in and learn and get more involved with climate solutions. And for me, this has been a deep dive and a dedication to environmentally sustainable healthcare. The term planetary health is used quite a lot when we talk in healthcare about sustainability. It was first used in the Western literature in a Lancet Commission paper in 2015. However, it is important to acknowledge this has been part of Indigenous worldviews from time immemorial, and is the concept that the health of the planet is a system, and that human well-being over the long term depends on the well-being of our Earth, including all of its living and non-living systems, recognizing that human health and the health of our planet are inextricably linked. In order to thrive, humans require clean air, clean water, and healthy soil. There's a lot to say about the human impact on the climate. However, when we talk about solutions, I like to think of it in terms of these 4 buckets, and they apply both at home and at work. Choices we make at home and actions, as we've seen from others presenting today, what we can do at work. So active transportation, this has health benefits to the individual as well, including improved metabolic and cardiovascular health. We need to electrify everything with the electricity created by renewables, so that everything we heat, our homes, our water, and we cook is done with electricity. Our food has a huge impact on climate and biodiversity loss. So eating plant-based, minimally processed food most days is better both for the individual and the planet. I'm not going to go into divestment, it's outside of the scope of this talk, other than to say it's a useful tool for everyone, from individuals to large corporate pension funds. The global healthcare system accounts for 4 to 5% of total greenhouse gas emissions. Diagnostic imaging departments are significant consumers of energy and resources, with estimates that radiology account for up to 0.8 to 1% of total global emissions. Radiology contributes to healthcare emissions through our large energy resource intensive machines and extensive use of single-use plastics, particularly interventional radiology. As with all health systems, radiology departments across the globe are faced with a challenge. The emissions that we create by providing care contribute to the adverse health effects of air pollution, environmental degradation, and climate change. A couple more important definitions are to review the terms mitigation and adaptation, which are broad and opposite but complementary terms. So mitigation is defined as what we can do to reduce greenhouse gas emissions and enhance natural carbon sinks of soil, forest, and ocean. On this slide are some examples that we can take in radiology, and I'll go over some of those in a few minutes. Adaptation refers to how we build resiliency to the expected impacts of climate change on human health and the healthcare system. And we heard about that with our first talk. It's really important to optimize response to changing patterns of disease and ensure continuity of care to safeguard human health. And there's a few suggestions that can be done in medical imaging just on the right-hand side of the screen, and that is ensuring that we have redundant backup power for data processing and storage. We have disaster planning protocols for our facilities, response protocols for staff, structural planning and reinforcement, as well as ensuring that our healthcare workforce is both educated about the climate crisis and that redundant staffing disaster plans are in place. So this is, radiology is resource and energy intensive, giving us this responsibility to reduce the environmental impact, but also many opportunities to do so. So this list is modified from the recently launched European Society of Radiology Green Certificate. The top three in bold are the sections of their biggest impact. And as we've heard earlier, engagement and education is crucial, and as is energy use. So the importance of education for everyone, technologists, clerical, operations, radiologists, patients, cannot be overstated. Understanding what is happening to our planet while we burn fossil fuels, the impact this has on our health, and the paradoxical contribution we make to this problem as we provide healthcare is fundamental to engagement. Once there is clear understanding of why and how we need to act, we can then identify the barriers to change and design inclusive and specific solutions. The peer-reviewed literature for environmentally sustainable medical imaging has increased significantly, like in many disciplines over the last few years. There's a few guides and overviews and references on this slide. These are each slightly different, however, they cover a wide range of possible stakeholders that could be of interest to these, including operations teams and policymakers. Building a green team is an essential step in transforming a local department to more sustainable operations, and this can apply to any healthcare settings. Reaching out of our usual silos in medicine to gather a diverse team provides some great opportunities to think outside the box and to be creative. The group should have a defined scope, a mandate, meet regularly, and feed data back to successful projects to the participants so that they can sustain interest and engagement over time. At BC Cancer, where I work out in Vancouver, British Columbia, a group of motivated physicians approached our executive in 2022 and gained their enthusiastic support to form a provincial level planetary health group. So this covers, oops, sorry, I'm hearing an echo all of a sudden. Are you guys? You're hearing an echo?
I think that's fixed. I just had to mute someone.
Oh,
It's gone, Maura. It was just someone needed muting.
Oh, okay, sorry. So since 2022, we've completed many projects with this Green Team working group, all of which engage frontline workers. And it's crucial to this process that we engage people and that we provide them with feedback to keep their interest and engagement. We've recycled patient binders. We've removed exam table paper from ambulatory clinics. We've published a sustainable travel guide for staff. We've developed a website with resources and references for any interested clinicians or employees. We've got videos for patients about health and the planet, a planetary health approach to catering for staff, We removed just recently across the province small office garbage bins, which saves 76,000 plastic bags a year. We supported a National Day of Action planting trees. We're supporting a deprescribing for older adults with cancer from one of our medical oncologists, and a study with one of our radiation oncologists using diagnostic CT to plan radiotherapy and obviating the need for another trip to the hospital for a CT sim. Many of these are done using the new value equation with the triple bottom line, considering sustainable healthcare. So this actually comes out of the UK in a paper published in 2018 by Francis Mortimer. So rather than the denominator of cost, which would be the typical value equation, it includes environmental and social factors. And many of those projects that I just showed you are built on a sustainable QI platform. So looping back to medical imaging, the energy and waste that we get from medical imaging is divided into production and use phases. The production phase is raw materials, manufacture, shipping, all the way till the manufacturer hands you the keys. The use phase is the energy to operate and cool the equipment over its lifetime. Production phase emissions from a single MRI machine consume as much as producing 76 gas-powered cars. CT is about 2/3 or 3/4 that of MR, and ultrasound is much smaller at about 8%. All medical imaging vendors currently have or are developing reuse, refurbishing, and updating protocols so that rather than buying entirely new equipment, you can get refurbished equipment that's up to date and perfectly functional, and this actually saves a ton of money as well. Like was mentioned in the last talk, many of these new protocols that reduce our emissions also save our healthcare system money. And this can reduce production phase emissions by 50%. The use phase energy is in the same order. MRI is about 5 times that of CT. CT is greater than ultrasound, etc. There are several ways to reduce the use phase energy of medical imaging equipment. These machines can be placed in lower power modes in non-operational hours. Although it's coming and it's not universally automated yet, most machines still require technologists to power them down. So this needs engagement and motivation by peers. Really important, again, to involve a green team, a local green team. By reducing idle time between patients, emissions per scan can also be reduced. We did a pilot project at my hospital.
Excuse me, I'm sorry to interrupt. This is really fascinating.
Going too long.
But, we're
I'll wind up. I'm almost done. Yeah. So you can turn off scanners, you can power down PACS workstations, interventional radiology as well. You can reduce with building emissions. So I'm just going to skip to, this is, I think, some of the most important parts for clinicians is low value imaging and clinical decision support tools. There are 2 sets of guidelines here. One is the European Society of Radiology and the other is the ACR, which help to determine, they're a little bit different, but they're helpful in guiding clinicians in ordering appropriate tests and reducing overuse. In Canada, we are still finding that Choosing Wisely Canada is very much on board with reducing overuse, and low value imaging is a priority. So this is the slide I showed you earlier with some of the areas of interest. And the take-home message would be, you don't have to be perfect when you start these projects, and it doesn't have to be complicated, and green teams are really important. So thank you for your time. And this is my email if anyone has any questions, and really grateful to be here. Thanks.
Thank you so much, Maura. That was really very fascinating. Appreciate your effort.
Yeah.
Our next and last speaker is Dr. Amy Booth, who is at the Nuffield Department of Primary Care Health Sciences at Oxford. She is part of the Radcliffe Observatory Quarter, and she'll be talking about prescriptions and prescribing and how they can be made more sustainable. Amy?
Great, thank you so much for the introduction. Let me share my screen. Is that visible to everyone? Let me make it big.
Yes.
All right, great. Well, thank you very much for having me onto this webinar. It's been really interesting listening to all of the initiatives that previous speakers have spoken about to help make the way we deliver oncology care more sustainable. So just by way of further introduction, I come from a clinical background, and decided to switch more into the research space and have spent the last 4 years completing a PhD looking at decarbonizing pharmaceutical supply chains. And so today I'm going to be speaking specifically about drugs, with some focus on oncology treatments, but really broad principles of how we can prescribe more sustainably considering the environment. And so I'll be speaking very briefly about the environmental impacts of pharmaceuticals and why we should care about them. I'll touch on that very briefly because people have mentioned some of this already. Then secondly, what are companies doing to reduce this impact? So these are some of the key stakeholders when we speak about reducing the environmental impact of pharmaceuticals, but then also what can oncologists and other healthcare providers and prescribers do to reduce this impact? So firstly, why should we care about the environmental impacts of pharmaceuticals? So as previous speakers have already noted, we are sitting in a very critical moment in time regarding our planetary health. We've already crossed 6 of the 9 planetary boundaries and unfortunately are to date making little progress to mitigate some of these impacts. And so this is a really urgent issue that has implications for health, but also for the way that we deliver healthcare. I'm going to be speaking about 3 key environmental groups that we should think about when we think about pharmaceuticals in particular. And so you have already been shown the NHS's carbon footprint, but what I want to draw attention to is the massive impact that medicines and prescribing has. So in the NHS, 17%, alongside inhalers and anesthetic gases. In the USA, for example, also about 20%. And if you look at this globally, these numbers tend to track regardless of which health system you're looking at. And so pharmaceuticals are a considerable proportion of health system carbon footprints. There's some data on specific drugs that we use, so that we know a lot about anesthetic gases, for example, desflurane being a large contributor in the space. We also know quite a bit about metered-dose inhalers and the impact that they have. So the pressurized inhalers that we use contain propellants that have very large global warming potentials, that are sometimes in the order of 1,000 times more polluting than carbon dioxide. And so those are some of the 2 pharmaceutical groups that we have a lot of data about. Unfortunately, for other prescriptions and drugs, we have very little data because a lot of that sits behind pharmaceutical companies and the data that they contain. Having said that, we do have data or studies rather on a scattering of different drugs like enrofloxacin, ibuprofen, and morphine. These tend to have specific carbon hotspots at points like active pharmaceutical ingredient production and energy use. And so obviously that needs to be taken into account during the manufacturing process of these pharmaceuticals. The other key environmental impact group that I want to quickly touch on is pharmaceuticals in the environment. And so essentially every medicine that we consume, but also all the drugs that we use in agriculture and aquaculture, that we give to cattle, for example, ultimately end up in our environment and contribute to ecosystem disruption. And so we've seen key issues around this, for example, disruptions of hormones in fish. So we've seen feminization of fish. We've seen it affect reproductive capacity of these animals. And crucially for human health, we see these pharmaceuticals contributing to antimicrobial resistance as these residues mix with bacteria in our environmental settings. And so this is essentially what pharmaceutical residues looks like in the environment. And you can see it's not a pretty sight. Then the third key impact that I want to speak about before I talk to solutions is really pharmaceutical waste, so the packaging waste. And so you've probably had conversations or it's been brought to your attention, how much blister packs we have and how much patient leaflets that we produce and patients rarely read that are in pharmaceutical boxes. And so how do we actually reduce that considerable amount of waste? It's also worth bearing in mind that a lot of pharmaceuticals tend to be managed incorrectly. So either they're sent for incineration or rather to landfill, which contributes to waste, or incineration, which is the preferred method, but which itself contributes to greenhouse gas emissions and toxins in the atmosphere. The other one that people rarely think about is biodiversity and the impact that pharmaceuticals have on that. And so I've got this picture in the background, which you might be aware of, but these are horseshoe crabs, and we harvest their blood to test for antibodies and toxins in vaccines. There is a synthetic alternative to this, but it's been quite difficult to scale that up because of regulatory issues. And so this is having downstream effects on ecosystems as we're using these crabs to do this. And so we know that there's a biodiversity impact, but there's actually very little data to back up what that is across the scale. And so those are some of the key environmental issues, and it's worth bearing in mind that these environmental impacts span pharmaceutical supply chains. So from the company side of things, but also right down to how they're used, prescribed, and managed within health systems. It can be quite challenging to reduce these environmental impacts for a range of reasons that have also been touched on by previous speakers. So issues around lack of awareness and training, limited data of the environmental impact for things like biodiversity that I mentioned, limited tried and tested solutions that have been scaled, technical challenges like wastewater treatment, so how do you actually filter out pharmaceutical residues, regulatory constraints I mentioned, distribution responsibility. So often we look at drugs and we say that responsibility is upstream, it's with the company, or companies look at health providers and say, well, you're prescribing these drugs, so you need to think about how you engage with that responsibility. And then I think the other thing that often isn't thought about as well is that we deliver healthcare with quite a biomedical reactive model where we're treating illness rather than preventing it in the first place. So what are pharmaceutical companies doing to reduce this impact? So this was a paper that we published a few years ago, which looked at the top 20 pharmaceutical companies by revenue, and essentially showed that they were actually making quite considerable progress in reducing their greenhouse gas emissions, so their carbon footprint across scope 1 and 2, which is essentially their direct and indirect energy emissions. Scope 3 is their supply chain, so that's all of their purchase goods and services and travel, etc. And so there's more mixed progress in that sense. This was obviously a few years ago, and so progress has been made since then. But these are some of the key actions that companies are engaging in. So renewable energy, energy optimization, sustainable logistics, product eco-design, supplier engagement, etc. And just a couple of examples briefly. So energy investments, circular economy, so Novo Nordisk taking insulin syringes and turning them into chairs, reformatting of packaging to reduce waste, green chemistry in the lab, which has been spoken about already, and this Energize program where pharmaceutical companies are collectively helping their own suppliers to purchase renewable energy. The Health Systems Task Force, you might be aware of as well, that's a public-private collaboration between big pharma companies as well as NHS and other academic institutions. And so action is happening, although it is happening quite sporadically and needs to be improved on scale. And then lastly, what do oncologists need to do about this impact? Because often how we prescribe and deliver healthcare has impact on the upstream manufacturing environmental impacts. And so there's some broad principles here that we can think about when we talk about prescribing. So as I mentioned, prevention and health promotion should be the first thing that we think about, because that mitigates the need to prescribe drugs. But then we also talk about rational prescribing, so the lowest dose, shortest amount of time with the best clinical efficacy. And can we embed environmental considerations in that as well and prescribe the lowest environmental impact drug? Obviously, we need data for that, and there is ongoing effort to help develop databases that will help that sort of prescribing. Other things like social prescribing, personalized medicine, really just trying to engage in sort of non-pharmaceutical interventions in the space. Reuse of medicine. So there've been quite a few studies done in the Netherlands that have looked at reuse of oncology drugs in particular. The problem with reusing medicines is that there's regulatory barriers to that. Safe disposal, I mentioned, digital innovation, so those electronic prescribing systems, can we streamline those? And then education has been spoken about as well. I just wanted to bring attention finally to 3 papers that have been published specifically on oncology treatments, just to show how the choices in medicines in the space can have environmental benefits. And so this one looked at the difference between immunotherapy and OIV treatment, for example, and you can see the massive environmental reduction from immunotherapy. Similarly, this looked at alternative dosing strategies of different oncology treatments, and you can see that depending on what doses you give, you can actually reduce greenhouse gases quite substantially. And so overarching all of this, I just wanted to note that prescribing is just one aspect of patient care. What we really need to do is deliver the best care that will get patient well as quickly as possible. And that tends to also translate into the most sustainable pathway. Lastly, I just want to draw attention to this report. So Una mentioned really nicely some of the actions that My Green Lab is doing around sustainable healthcare research. And so this was work that we did with the Academy of Medical Sciences in the UK and the National Academy of Medicine in the US, which published essentially recommendations for good practice on environmentally sustainable health research. And so if anyone's interested, you can access that report. So thank you for your time and look forward to taking questions.
Thank you very much, Amy. In the document that you talked about just there from the National Academy, what were the key things, the key take-homes, the coffee cup read for readers from it that they should take home?
No, sure. So I guess the first takeaway was that there's actually very little data in the space looking at health research and its environmental impact. But the data that does exist shows that it is quite substantial. So for example, carbon footprints of clinical trials. And then based on that, we drew out key areas where we think action is needed. So improving data, improving supply chains and procurement for health research, education capacity building, looking at infrastructure, and then there were a couple of other areas that we looked at. But yeah, those were sort of the key takeaways. Thank you.
So we're going into a question and answer session for the remaining 15 times. So if for those online, if they have questions, if they put them into the chat, and then they'll be visible, and we can ask the speakers. While that is happening, I was going to ask each of you what you would say advice to colleagues. You would say to colleagues about getting involved in this area. So just starting, Sarah, we'll start with you if that's okay.
Yeah, of course, happy to speak about that. I think probably for me, the most important thing is making connections with other people who are interested in this area, just talking to people about it and trying to either bring people along with you or connect with people who are already working on this. I think it just helps motivate anyone to have sort of, to feel that they're not alone in this, and also sort of, the more you talk to people about it, the more ripple effects that you'll have. So you might inspire someone by telling them about what you've been doing, and they might inspire you or give you a new idea. So yeah, that would be my top tip. Just keep making connections.
Just Una, you talked about your epiphany moment, but how difficult was it to get this going, get this My Green Lab going?
Long as a piece of string. I mean, it was tricky enough. It was, I think, a key thing. The reason I put senior buy-in is important, that, especially if you're the first person in your organization trying to start it, that you need some kind of senior. Okay, I'm senior enough myself, but I mean, to get support of the people who have money to fund something, I think is quite important. And it made it so when Alison Paradise, she actually came to Ireland to give us the cert, because people said, oh, this is a big deal and we need to get over. So to get someone to pay for that. But senior buy-in is important. I think what you were saying, Sara, about talking to people, it is a weird thing if you're new, like, why was I, with my background, I'm not officially in sustainability, why am I talking about this? So I think it was, people are used to it now and they kind of hide their water bottles when they see me coming, but it's just senior buy-in, talking to people, as you said, but I think attacking it from all angles. And the more senior you go, the more you have to talk about money. So that's why the return on investment is a key thing. And I think as long as the community who's implementing whichever action, reducing energy especially, you're saving money. So gathering the data on that so that you can share it up the chain will mean that people will start to pay attention to what you're doing. And I think that's important, you know. So gathering the impact information is useful. Yeah. So
Maura, I liked your quote, places of healing should be leading the way. And just in the radiology community, how difficult has this been to get activity on?
It's a challenge, but there's a growing interest in this work. I think people realize that we have responsibilities to lead and, you know, engage our peers. I think one of the most important things is education. So webinars like this and drawing people into understanding why it's important is crucial. And then, as Una said, you know, the clinicians on our own run into brick walls sometimes because we don't necessarily understand all the finances and the operations of big health systems. So it's super important to have executive and operations support as high level as you can. Like our Planetary Health Unit, BC Cancer leadership is a collaboration between clinicians and executives. So forming a green team so that you can spread the word and educate people, and then also make sure that you have engagement of people who make policy decisions and have control of the money. But you know, it's very important that clinicians collaborate with those people, because that's how we'll move this forward together. And one more thing I think that's really helpful is that healthcare can be very siloed. Like, we do what we know well, and we don't tend to reach out to people who approach healthcare quite differently. So even within departments, like involving your technologists and your you know, your day-to-day administrative teams, it's really important. And then reaching also across to other specialties to talk to people about what they do and how they see things, because then you can solve problems by thinking creatively.
There's a question in the chat which I think is directed at yourself and Sarah about the climate impact of radiomics.
Sarah, do you want to attack that, or would you like me to?
Sorry, struggling to unmute myself again, but I think that might be one that's better for you to take. I know very little about radiomics. Yeah.
Well, I don't know a lot about it either. I do know that the energy use of AI and technology is enormous. We are finding in radiology, for example, we can use AI with our MRI machines to fix up the appearance of the sequences so that we can do them in a shorter period of time. So if you can do, you know, shorten a head MR from 40 minutes to 20 minutes, and then the emissions per patient are less. So we know that with AI, and AI is also going to be very useful. I know this isn't quite radiomics, but it's going to be, there's a lot of debate about AI. Is it a good thing or a bad thing? And I think the jury is still out. The most important thing is if you're using AI to find out what the data center is using for their electricity, their scope 2, are they buying their electricity renewably? That's probably the most important thing. And then how we incorporate it into our work will obviously, as it helps us sort of streamline our scheduling and our workflows and our sequences, will be helpful. But really important to be thoughtful when you purchase any type of new IT is where they get the energy from. There's the scope 2 emissions. I hope that answers the question.
Una,
yeah, just since you raised data centers, I think obviously one of the clear-cut best ways of using non-generative AI, I would say, is for analyzing images, medical images and things like that. That's very clear. And drug discovery, maybe of chemicals, you know, matching them to proteins, you could say that's okay. But in case the non-Irish people might not be aware, but in Ireland, the AI centres are using all of our renewable energy at the moment. So all of our efforts on renewable energy, which is like 19%, have been completely gobbled up by the data centres in Ireland. So we have to be very careful about it, at least within Ireland, in my opinion. So so I think it's great that you're asking that question, where are they getting their energy from? You know, yeah.
So we have more questions in the chat, but I just wanted to finish this by asking Amy what advice you would give to colleagues about being involved.
Yeah, no, thanks, Seamus. Well, I think just to say that there are many, many, many organizations that are looking at sustainability, increasingly so, which is exciting. I'm currently putting together a systems map to try and understand who they all are in the UK. So that's to be continued, but it's already, you know, on several tens of organizations. And so I guess what advice I would give is find the one in your setting and in your field, and reach out to them, try and get involved to them. At this point, I think there's a need to bring some of these groups together so that we stop working across the silos that a lot of people have spoken about. And so there are sort of larger communities of practice, the Planetary Health Alliance being one of them, that would be worth looking into as well. And I think there's just a lot of space to engage in ground level, bottom up initiatives. And so if you see gaps like that in your own settings, my advice would just be to go for it.
Thank you. We have a question. One of our patient advocates is asking about what can patients do to help sustainability? Would anybody like to address that?
I can tackle that a little bit. We recently had a patient join our planetary health working group at BC Cancer. And one of the first things she brought forward is patients need to know more about what you're doing. So that has now led to us having our organizational communications team lead as part of our planetary health group. So we'll be able to have posters in lobbies and in elevators and patient newsletters and things like that. So I think as a patient, as an advocate for this, speak to your healthcare providers, and all health organizations will have patient feedback portals. You can provide that information. Say, I'd really like to know that my healthcare is being delivered as sustainably as possible within the constraints of the care that I need, because organizations respond to what patients want. Like, that's why we're here. So I think it's really important to hear the patient voice. Thank you for that question.
And then
can I just jump in and add as well that I would love our working group to have a patient representative. We don't currently, but if you know anyone who would be interested, I'd love to chat with them. And then also I think for patients, I think probably one thing that people can ask that is really helpful is maybe not so much people who are just being diagnosed with a cancer, but generally for patients and for people who've had cancer treatment. It's just, what can I change about my lifestyle to address this problem holistically and try and keep myself in as good health as possible just from lifestyle things.
So the other, thank you. The other question in the chat relates to setting up cancer research funding as an opportunity for win-wins across many areas. And how we can do that. So I think that the concordat, a lot of the things that you talked about, Una, with the concordat and sustainability statements, I think
that's going to have a massive impact. Basically, the funders mandating some kind of evidence of effort to do with reducing the environmental footprint is having a big impact. So yeah, it is a win-win, because I sometimes think that for technical staff, it's like it adds another element to their daily work, because many of them are actually PhDs who didn't manage to the openings in academia, or there are very few of them really, but at heart they are researchers, and there's a whole kind of track for doing research and gathering the impact and publishing it in environmental journals, or that sort of thing, and it will raise the profile of the effort. But yeah, certainly the funders requiring efforts, I think, is huge. It's really, really helpful. Yeah. So
thank you. My final question to everybody in the remaining minutes is, what do you hope to do in the coming years? So I'm going to go anti-clockwise on my clockwise on my. So Amy, I'm going to ask you first.
Sure. I mean, in an ideal world, we want to create health systems that meet the needs of people and the planet, but that obviously involves absolute overhaul of economic and political and health systems. But in the more immediate future, I'm currently part of a large UK-wide group, the Green healthcare hub, which is looking at different pathways to decarbonizing health and social care. And so my specific focus there is on sustainable medicines and how we can reduce the environmental impact across the pathway of medicines within health systems. So from how they're procured right down to how they're prescribed or overprescribed, the storage, logistics, right down to how they're disposed and managed. And so I guess if anyone's interested in that sort of focus, I'd love to connect and essentially just try and reduce medicines wastage, which has financial and patient benefits as well.
Thank you. Sarah?
Thanks for the question. So I think from the Radiotherapy Board's working group point of view, what I would like is for us to be a bit less siloed. I mean, oncology isn't just radiotherapy, and I think we want to iterate on our framework, but I think, you know, my dream would be to expand that out to other areas of oncology and sort of get more of a community of practice going within oncology in the UK.
Maura?
I think that I'd love it if planetary health just became part of everybody's job. Everybody working in healthcare had something to do that was engaging and contributing to a better world. And to do that, we really need both top-down policy change and funding, and we also need like support and project time for people on the front lines in the clinical care. So the two groups kind of work together so that it just becomes part of what we do, rather than this added on kind of afterthought that a few people are interested in, but that it becomes an integral part of providing healthcare, is to always think about the planet with every decision that we make. That would be, but then we wouldn't have all of these problems.
Yes.
It'd be so much easier.
Absolutely.
Thank you.
So Una?
Yeah, that's a brilliant one, Maura. I mean, every decision is a green decision, you know, that culture. I agree with you completely that it, and especially, of course, I'm coming from the lab setting, so that the people who run labs, that part of their job should be to minimize the impact. So at least they go as far as they can. Personally, we're trying to possibly set up Irish Green Labs as a charity. So that's one of the things on my to-do list. But I think just raising the profile of the potential benefit of having lab greening wherever there is a lab is something that I would hope to help with, you know, in general, and to connect with people in Ireland and outside Ireland on that. So, yeah.
Excellent. Well, our time is up, and I just want to thank all of our virtual speaker and our 4 in-person speakers for speaking today, and for the efforts and thoughts and work that has gone into the talks that you've and experiences that have gone into the talks that you've given in this area. We're very fortunate to hear from key opinion leaders in this field at today's webinar. I'd like to, on behalf of Joan and myself representing Ouch and Cancer Trials Ireland, I'd also like to sincerely thank Claire Hopkins from Cancer Trials Ireland for orchestrating the webinar and promoting it on social media, and all of the quiet pivotal background work that goes into making events like this happen. So thank you, sincere thanks, Claire, for a job well done. And I wish you all well, and it was great to see a community here today, and I think a growing community and a necessary community. So thank you all for those who dialed in today, and for your helpful questions, and for being part of this of today's London Global Cancer Week webinar. I wish you a lovely day, and for those of you in American jurisdictions, I wish you happy Thanksgiving, and for those who aren't, a happy holiday season ahead. Thank you very much.